Hi everyone, today we are going to discuss about short stature and the approach to treatment with short stature. Because we know children are always having three growths. First is height, second is brain, and third is sexual maturity. Because previously, whenever any parent used to bring a child to a pediatrician, parents used to tell, Doctor, my child is not growing. So what do they mean by growth? It was always weight and weight. Parents are more concerned that the child is not eating and child is not gaining weight. Now we know that 50% of the so-called lean children who are very lean at 5 or 7 years, you see them at 15 or 20 years, they are fat like anything. The same parents who brought this child at the age of 5 or 6 years for short stature or whatever with lean body habitus will bring the same child at the age of 15 to 20 years for obesity and treatment of weight gain. So ultimately children always, I tell, have three growths only. They have height, brain and sexual maturity. For height, you require the hormone of growth hormone. For brain, you require the hormone of thyroxine. For sexual maturity, for a female, you require the female sex hormone estrogen and male hormone of testosterone. And what about thyroid? Thyroid is now universally screened. For the past 12 years by the WHO guidelines, any newborn baby born throughout the world is being screened for thyroid. So congenital hyperthyroidism is almost never missed. A baby is born in the world, within 24 hours of discharge, they are being screened for TSH. And nowadays, above 3 years also, any child going for any goiter, tiredness, decrease in school performance or even weight gain, the pediatrician also writes for a TSH. So thyroid is almost overdone now because people are checking thyroid any time of the day. What about sex hormone? Even now we know that females usually attain menses or menarche by 12 years. Suppose a mother notices that the child is not having breast development or not attaining menses by 13 or 14 years, the mother will at least take the child to a gynecologist and ask, Doctor, my child is 13, 14 years, she is studying in class 7 or class 8, other children has attained menses, my daughter has not attained menses. So sexual maturity in a female is also almost set. But what about height? I told you three development for a child: height, growth hormone, brain thyroxine, sex hormone estrogen in a female and testosterone in a male. Thyroid you are almost overdoing and checking day by day or monthly or yearly basis. Sex hormone, at least if the breast development or menses doesn't occur, you take to your gynecologist. But what about short stature? Suppose you take a child at the age of 5 years, 6 years, even to a pediatrician previously for short stature, doctor used to say, don't worry, this child is just 5 years, ask him to eat properly, ask him to exercise properly, ask him to play basketball, you come and meet me after 10 or 15 years, we will think about what is the cause of short stature. That time everyone used to think that every short child 5 or 6 years is going to be tall at the age of 15 or 16. That never happens now. 50% of short children actually gain height at the age of 14 or 15 because they are late bloomers or they are having a constitutional delay in growth and puberty. That is, they grow slowly. By the age of 13 or 14 years, they enter puberty and then they grow. But that occurs in only 10 children with short stature coming to OPD, 5 out of 10 or 50%. Remaining 50% of children are actually having growth hormone deficiency or growth hormone responsive condition which can help in height gain. But what happens? These children also wait till 15 or 16 years. By the age of 15 or 16 years, they come to an endocrinologist and tell us, Doctor, my child was growing till 12 or 13. Now he's not growing for the past 3 years or she's not growing for the past 4 years. We can take growth hormone. No. So whenever you notice that your child is not growing at par with other children of the same age group, or your elder son is growing but younger son or daughter is not growing at par with the elder population, or you are going to the school, then the school every children is used to align depending upon the height status. So you are going to the school, your son or daughter is always standing in the first row whereas other children are moving back. These are the clinical clues to know that your child is not growing well. So don't wait till 15 or 16. Go to a doctor or a pediatrician or an endocrinologist who specializes in short stature by the age of 5, 6, 10 or whatever year you notice short stature. Ask the doctor, Doctor, my child is not growing. I went to the assembly in the school. Other children are much more taller than my child, or my elder son is growing but my younger son is not growing at par with the elder. What is the cause? Will he normally gain height at the age of 14 or 15? Is he a late bloomer or a growth hormone deficient conditions? If at all the doctor tells, don't worry, doctor is doing growth hormone, thyroid, X-ray left hand for bone age and telling, don't worry, he is a late bloomer, we'll just monitor. You come back every 6 monthly and we'll do a height monitoring. Okay, you be happy, go to an endocrinologist and monitor that. Suppose the doctor tells, no, he is not a late bloomer, he is having growth hormone deficiency or a condition which responds to growth hormone, start growth hormone treatment immediately. And you should ask me, Doctor, what is the problem if we delay the growth hormone treatment? Because we know that 90% situations the bone fuses between the age of 14 to 16 years. So once your bone fuses, there is no point in taking growth hormone. Thyroid hormone can be taken at any age right from the time of birth till 90 or 100 years. Sex hormone in a male also can be taken right from the age of 13 years till the age of 65 years. Female, it can be taken from 12 years till the age of 50 years. But growth hormone is the hormone for height. It should be taken before your bone fuses. Once the bone fuses between 14 or 16 years, there is no point in taking growth hormone. That is why many of the children who come to us for short stature, they come at 18 or 20 years. Then they come and tell us, doctor, I want to gain height. My sister is gaining, I'm not gaining. Or some people come and say, doctor, I want to become a pilot, I want to become a police officer. My height is only 150. Give me growth hormone, let me gain it. You check their X-ray, bone is already fused, so you can't do anything. So basically understand, children have three growths: height, brain and sexual maturity. Brain it is thyroxine, sex hormone, female it is estrogen, male it is testosterone, but height it is only one hormone, growth hormone. And in a female, what's the most important thing of short stature? Because female child gains maximum height after breast development and before menses. Once menses starts, that's the start of menses starts, the bone fuses, and the maximum height that is gained in the life of a female child after the onset of menses is 4 centimeter. That is, suppose my daughter is having the age of 8 years. So she is having her breast development by 8 years. She is going to have her menses by 10 years. So previously menses, or the first start of menstruation, used to occur by 15 or 16 years. Nowadays menses starts by 10 or 12 years. Suppose my daughter starts her menses by 10 years, she will be the tallest in the class up till 10 years. But after 10 years, once the menses starts, her bone fuses, then she is going to gain a maximum height of 4 centimeter. So our parents will be saying, my daughter is just studying in class 4, she's at 10 years, she will grow till 16. That never occurs because her bone has already fused, because her menses has occurred. So basically understand the concept only. Whenever you think that your child is not growing at par with the children of the same age group, you are going to the assembly or you are comparing with the child's friend. Your friends are growing but my child is not growing. Don't sit at home giving food, milk or butter and ask them to play basketball. That arise out. Feeding and food contributes to only 10% of height, because 90% of height you require growth hormone, not the food you take. That is why children or the basketball players with good height are not fat. They are having good height only. But growth hormone deficiency should be treated before the bone fuses. That is any age, 1 year, 2 year, 3 year, 5 year, 10 year. The moment you find out the child is short, immediately take your endocrinologist, ask an evaluation, growth hormone, karyotype, calcium, vitamin D, your B12, your renal tubular acidosis, hemoglobin, everything. Suppose the doctor after evaluation and taking the X-ray said no problem, your child is a delayed puberty, we will monitor every 6 months. Okay, go meticulously to the doctor every 6 monthly and monitor. Suppose the doctor lets know the child is not catching up, it's a growth hormone deficiency or growth hormone responsive condition, start growth hormone immediately. Why am I telling this with so much interest? Yesterday also one parents, father, mother, both having a height of 170 centimeter. So the average height that a child should gain according to the parent's height is father's height in centimeter plus mother's height in centimeter divided by 2 plus 6 point for a male child minus 6 point for a female child. Basically understand the average height. Suppose my daughter 10 years, my son 15 years. What is the average height that he or she should gain when they become an adult? It is father's height in centimeter plus mother's height in centimeter divided by 2 plus 6.5 centimeter for a male child minus 6.5 centimeter for a female child. Suppose a father, mother, both are having 170 centimeter. So it is father's height 170 plus mother's height 170 divided by 2. So again 170 plus 6.5. 176.5 is the average target height for the male child. Father's height plus mother's height divided by 2 minus 6.5. That is 170 plus 170 divided by 2. Again 170 minus 6.5. 163.5 is the average target height for a female child. So why did I tell this? Yesterday also father, mother both 170 centimeter coming with the daughter having a height of 148 centimeter. Daughter is of the age of just 11 years. They are telling that, doctor, my child is not growing for 2 years. We heard about growth hormone. Shall we start growth hormone? And this girl is very active. She's playing so much about games, everything. She's having dance competition. But whenever she goes for dance, she's made to stand in the front row because she's the shortest in the class. So I asked her, what about her menstrual cycle? She's telling, no problem. She attained her menses at the age of 9.5 years. So father, mother 170. So 170 plus 170 divided by 2 minus 6 points. She should gain a minimum 163.5. But she attained her menses at 9.5 years. They are coming at the age of 11 years for height gain. You check the X-ray and the bone has already fused. You can't do anything in that condition because once the bone fused, growth hormone is of no use. So basically understand, whenever your child is not growing or growing, this is known as growth chart. So from this, so whenever you go to a doctor, assess this the growth chart for girls, this the growth chart for boys. So ask the doctor to check the height, check the average parental height, that is father's height plus mother's height divided by 2 plus or minus 6.5, and the doctor will assess the height velocity every 6 monthly to 12 monthly. So suppose the height velocity is poor or the growth hormone is poor, start growth hormone immediately. And what is bone age? Height never depends upon the calendar age. The daughter or my daughter's calendar age may be 10 years, but once she attains menses, fuses, her bone age will be 14 years. That means that your bone fuses much more earlier when your menstrual cycle or sexual maturity occurs. That is why doctors always take an X-ray left hand. That is known as a bone age, whether the bone has fused. So once the bone has fused, there is no point in taking growth hormone. That is why coming for short stature at the age of 16, 17, 18 years is not going to have any benefit on you. The moment you control or moment you spot a child with short stature, immediately take to an endocrinologist, check the growth hormone. That is known as human growth hormone. It can be taken once daily and once weekly. Growth hormone is available, and start growth hormone and ask the child to have a healthy life and a confident life. You can ask me, what is the problem with living with short stature? Short stature doesn't have any disease symptom. You don't have a liver disease, kidney, heart attack or cancer. But the ultimate stigma of a child with short stature is inferiority complex. Right from your schooling times to your pubertal days to your whatever, when your marriage days or your parenthood or grandparenthood, or when you are going to buy a new dress also, ultimately the stigma of having short stature always haunts a person. So that is the value of growth hormone, and check growth hormone, go to an endocrinologist. If the child is not having height, start treatment with growth hormone. Let the child live as an adult with a good stature and good confidence. Thank you.